Ankylosing spondylitis. Ankylosing spondylitis is the chronic inflammation of joints between the vertebrae or between the spine and pelvis. Also known as rheumatoid spondylitis or Marie-Strumpel disease, it is marked by impaired mobility of the spine, pain, stiffness in the hips and lower back. The pain progresses to the upper back, eventually affecting the entire back, resulting in loss of flexibility.
Arthritis mutilans. Arthritis mutilans, a rare but often debilitating and destructive form of psoriatic arthritis, affects the small joints of the hands and feet, sometimes affecting the neck and lower back.
Arthroscopy is a surgical procedure by which surgeons can view the inside of a joint using an instrument called an arthroscope, thereby enabling to diagnose and treat problems inside a joint. Arthroscopic surgery is only performed after a thorough medical history, physical examination, X-rays, and possibly additional tests such as magnetic resonance imaging, MRI, or CT scan. This procedure is commonly performed to treat joints in the knee, shoulder, ankle, and the elbow. During arthroscopic procedures, a small incision is made in the skin through which a tiny instrument, an arthroscope, with small lens is inserted. The arthroscope is attached to a miniature television camera which records and displays the inside of the joint on a monitor, enabling the surgeon to diagnose and treat the condition.
Bone cancer. Bone cancer is a malignant growth in the bone. The tumor either originates from the bone itself, which is rare, or is secondary, that is, occurs as a result of cancer spreading from elsewhere in the body. Bone marrow. Bone marrow is the soft, fatty tissue found in the bone cavity. Bone marrow contains immature cells called stem cells that develop into red blood cells, white blood cells, and platelets.
Bone remodeling. Bone remodeling is a continuous process of resorption, or removal of old bone cells, and ossification, or formation of new bone matrix to ensure mechanical integrity of the bone and calcium homeostasis in the body.
Coccyx. Commonly referred to as the tailbone, coccyx is the final segment of the human vertebral column. It is triangular in shape and is made up of 3 to 5 separate or fused vertebrae.
X-ray absorptiometry, DXA. Dual energy X-ray absorptiometry, DXA, or bone densitometry, is an enhanced form of X-ray technology used for measuring bone mineral density, BMD, in order to evaluate bone loss.
Osteoid is the unmineralized organic portion of the bone matrix that forms before the calcification. Osteoid is composed of fibers and ground substance. The process of formation of new bone tissue starts with the osteoblasts secreting the osteoid as specific proteins, and the mineralized osteoid forms the new bone tissue. The rickets in children and osteomalacia in adults are the results of accumulation of osteoid, which does not mineralize properly due to the insufficient mineral or osteoblast dysfunction.
Spondylitis. Spondylitis is the inflammation of the vertebral joints, resulting in backache and neck pain.
Like and subscribe Focus Medica channel for more health tips and educational content. Share your thoughts in the comments below.